Doctors have repeated for months that COVID-19 vaccines are safe, but myths are still spreading. We have an infectious disease doctor who's going to break down vaccine myths, mask wearing, and answer all your health questions next on Dr. Q&A. Welcome everyone to Dr. Q&A. I'm Olga Villaverde, and joining us today from Vanderbilt University Medical Center in Nashville, Tennessee is Dr. William Schaffner, a professor of infectious diseases. Thank you so much for joining us on Dr. Q&A.
Good to be with you, Olga. Of course. Bring those questions on.
Great. Oh my goodness, doctor, we have so many questions, but before we get to them, I just want to let our viewers know that if you have a question for our expert today, it's really easy to get in touch with us. You can email us, you can phone us. There's the information. Email questions@allhealthtv.com or give us a call, 855-796-4475. All right, doctor, just like you said, lots of questions. We have a viewer question from Rosie. Let's take it. How long after getting COVID should you wait before getting the vaccine? So doctor, your response?
So Rosie, there used to be the recommendation that you should wait for 90 days, but that recommendation is not in force anymore. So after you recover completely, have no more symptoms, you're free to get the vaccine. And you should get the vaccine even though you've had COVID, because the protection in your blood is much greater after the vaccine than it is after the natural infection. And the more protection you have, the longer the protection will last. So get that vaccine.
I am so glad you answered that, because I hear from so many people, you know, I had COVID, Olga, I don't need the vaccine.
But you do, for just the reason that I said. And also with those variants out, the more protection you have in the bloodstream, the more likely it is that you can take care of and protect yourself against those variants. So there are two good reasons, even though you've had COVID, to get the vaccine.
Great stuff. Okay, doctor, we have a video question from John. Let's take it.
Hi, doctor. My name is John. I've been vaccinated and I was wondering, does my reaction to the vaccine indicate anything about my level of immunity to COVID? For example, if I had a bad reaction, does that mean I'm more immune than if I have no reaction?
You know, doctor, I'm so glad John is asking that. That's a great question, because I had a terrible reaction.
Well, I'm sorry about your reaction. I'm sorry about John's. Young people have more reactions than do older people. But as we know, the data show us that this vaccine protects older people just as well as younger people. It just means that your immune system, when you have more of a reaction, reacts more briskly. But the ultimate protection does not relate to the amount of reaction that you had. This vaccine works very well across the age spectrum. Now, starting at age 12, all the way up to however old you are.
And, you know, I'm really grateful for what you said about young people don't have so much of a reaction, and some people do as well. I'm obviously not young. It was the second dose, doctor, that really hit me for like 24 hours, not the first one. I've heard that from a lot of people as well. Why is that?
Well, Olga, your immune system is primed by the first dose, and it's wakened up to COVID. And the second time it sees the COVID vaccine, it responds more vigorously. And we think that that's what accounts for somewhat more reactions after the second dose than the first. But those side effects, as you can probably testify, go away in 1, 2, at the most 3 days, and then you're fine and you're protected.
Absolutely. And it's so worth it. Like I tell everyone who hasn't gotten it, get the vaccine, be safe. And It's peace of mind. Okay, so doctor, before we continue, I want to remind our viewers that if you'd like to send in a question to our expert, so easy to do that. Call us at 855-796-4475 or send in your questions to questions@allhealthtv.com. This one, doctor, I love. The Centers for Disease Control and Prevention say people who are vaccinated against COVID-19 can safely go without masks indoors and outdoors. We just got the news. So there are some exceptions, I believe, doctor, correct me if I'm wrong, but maybe airplanes and buses. Do you think it's still a good idea to do this considering we haven't reached herd immunity? Take it away.
You know, we've been waiting for some time. We get all these questions from people who've been vaccinated. So, doc, what can I do now that I'm vaccinated and I've finished my vaccine series that I couldn't do before? And we've been telling them not much. Keep wearing your mask, stay socially distant. Now the CDC has got enough confidence that this vaccine is really working very well in the clinical trials. Cases are going down. And now the CDC has said, I think we can take this next step so that if you've been vaccinated, you can not only take your mask off out of doors, you can take it off indoors. And as you say, Olga, there are a few exceptions, not in huge crowds if they're indoors, and also not in public transportation and when you come to medical facilities. Let me add one other thing, if I may. You know, there are people who are immunocompromised who live among us. They come in all kinds of forms, people who are receiving cancer chemotherapy or immunosuppressive drugs. We know that they don't respond optimally to the vaccine. So what should they do when they're indoors? For the most part, we're suggesting that they take it easy. Maybe they should take the belt and the suspenders approach. Get vaccinated and wear your mask, because, you know, the vaccine probably didn't work optimally in you, provided only partial protection. But for the rest of us, I think that taking off the mask indoors is, in most circumstances, something we can do and be calm about it.
Now, let me piggyback on that, doctor, if I may, and I'm just going to use me as an example. This morning, I went to the supermarket, and I would have to tell you that possibly 3 out of 10 were not using masks, and the other 7 were. So obviously, it's a choice right now where some people just feel some hesitancy, if you will.
Mm-hmm. There isn't any doubt. There are still many people who are vaccinated, are not immunocompromised, but they've said, we're going to go gently. We're still going to wear the mask for a little bit longer. You're not obliged to take off your mask. That's a matter of personal choice. And Olga, the other issue that comes up is, well, I'm vaccinated. I go to the supermarket and I see unvaccinated people around me. How do I know that they've really been vaccinated because they're walking around without their masks? So we have to trust our fellow citizens. And if you're a little uneasy about that, and some people are, that's okay. Wear your mask and you'll be more content.
That's a great point, doctor. Do you think the fact that now in some areas people can be without masks if they have been vaccinated, do you think the more people see this, the more it'll stimulate people to get vaccinated so they don't have to wear the mask? Because I don't really think many people like it.
Well, I'm a healthcare provider. I wear masks all the time. I don't think, I can't see what the big deal is, but I know it's out there and people don't like to wear them. But that aside, I think that, I hope certainly that this kind of reward for getting vaccinated will help some of the hesitant become vaccinated. And I think this will happen probably in a family and neighborhood context where people will say, Charlie, why don't you get vaccinated and then you can join the rest of us and take your mask off and we'll all be more relaxed. So I hope that family members persuade family members to become vaccinated along with neighbors and friends. We need to vaccinate many, many more people here in the United States to keep the case count going down and staying down. And there are parts of the country where vaccination rates continue to be, I'm afraid, quite low. So we still have a long way to go. We have plenty of vaccine. Come in, roll up your sleeve. It's there waiting for you.
Absolutely. And that's why we do shows like this, to help people understand more about it. And we're going to be talking about some myths later on in the show, which I know will interest our viewers. But first, since we're talking about the vaccine, Doctor, I want to focus on the Johnson & Johnson, that one-dose vaccine. It's available again after the FDA recommended a pause in the use of the vaccine, which many of us heard about that. Let's watch this explainer on the vaccine, and we're going to talk about it on the other side. Take a look.
Federal officials have lifted the pause on the use of the Johnson & Johnson coronavirus vaccine, saying the benefits of getting vaccinated far outweigh the risks from potentially dangerous blood clots. States are now offering the J&J one-shot vaccine at sites around the country. Officials have issued updated information that warns people about what to watch out for in terms of symptoms: severe headache or blurred vision, abdominal pain, severe leg pain, shortness of breath, chest pain, easy bruising, or tiny blood spots at the site of the injection. Officials say the overall risk of the blood clots is very low, but the risk is 3.5 times higher in women ages 18 to 49.
So, Doctor, let's chime in on that a little bit. First of all, why are women in the age group of 15 to 49 more at risk? And should women in that age group look for another vaccine? What are your thoughts?
So, Olga, first of all, let me say that explainer was very, very clear and completely accurate. And if you want a sense of how rare it is, it's one episode of blood clots in that younger woman age group for every 250,000 injections given. It really is a needle in a haystack, but it's real. Now, we don't know medically why it is that women under the age of 50 are more likely to get this than, for example, older men are. But it's just a fact. And if you were somewhere talking to your physician or other healthcare provider and thinking about getting a vaccine, and you were a woman in that age category, you might well consider, if the Pfizer or Moderna vaccines are available down this street, J&J down the other, it might be useful for you or preferable for you to get the Moderna or J&J vaccine, even though that does require 2 doses. The great advantage of the J&J vaccine, of course, was one and done.
Absolutely. I got the Pfizer, so I had to wait my few weeks for the second dose. By the way, for our viewers, if you want to send in a question to our expert, just email us your question or call us 855-796-4475, or you can email the question, send them to questions@allhealthtv.com, or you can also send it via our website right there to your right, allhealthtv.com. Doctor, I love this question here. Some experts were actually worried about the possibility of a twin-demic. Do you know what I'm talking about?
Oh, yes. I was one of them. We were worried that this last winter we would have an outbreak of COVID. We got that. But we didn't have an outbreak of influenza. In fact, it was the lowest influenza year that any of us can remember. And of course, the reason for that is, well, a lot of us got vaccinated, but I think the main reason was all those shut-ins. We stayed at home. We didn't go to work. We didn't intermingle. And in particular, the children didn't go to school. The children, you know, they have the distribution franchise for the influenza vaccine, for the influenza virus. They spread the virus amongst themselves and bring it home to mom and dad and the grandparents and the neighbors. Well, they all were out of school. They didn't even play together very much. So it was a very low influenza year. But we think it's coming back this fall. So it will be time to get vaccinated once again against flu in addition to COVID.
You just beat me to the question, the follow-up question that all of us reporters ask. And that is, can we expect an increase during the flu season? And should one get that flu shot come next flu season? Yes?
The answer to the flu shot is, of course, yes. And it's everyone older than 6 months of age. You don't have to think about it. Whoever you are, you're eligible for flu vaccine. And we think it's coming back. Will it be a big year, medium, or small? Flu will tell us. It's very hazardous to predict influenza. It's so variable.
Okay, doctor, I had told our viewers that we were going to get to some myths that I'm sure you hear all the time, and I hear them too. So let's debunk some of them. Shall we do that, doctor?
Sure, let's go.
Let's go. Here's the first one. We can't trust COVID-19 vaccines because they were rushed. Doctor?
They were made very rapidly, but let's put this into perspective. This is a new technology. New? Actually, we've been working on this new technology for 20 years, so it's not so new. And now along comes COVID. We have this pandemic, and all the resources, private and governmental, were put together to create this vaccine, yes, in a very rapid fashion, but it was intense. We did some things simultaneously that are usually done in sequence. Let me give you one example. If you were the CEO of a large vaccine manufacturer and you had a new vaccine and it went into a clinical trial to see whether and how well it worked, well, you'd wait for that trial to be finished and show that the vaccine worked before you started to manufacture it in millions of doses. Because obviously, if the vaccine didn't work, you wouldn't manufacture it. But we didn't do that. You and I, as the taxpayers in the United States, were so convinced that this vaccine was going to work that we told the manufacturers, while the trial is still ongoing, we're going to start manufacturing this vaccine so that as soon as the trial was over and we showed that it worked, we could start administering it. So we do things simultaneously rather than in sequence. That saved a terrific amount of time. Yes, we worked intensely and rapidly. No corners were cut. This is a safe vaccine.
So glad we got to that myth. I have a couple more, doctor, but I just got a viewer question from Facebook from Marky. So I want to take it right now. It's kind of cute. I have had COVID and I am fully vaccinated. That's fantastic. I put my mask away. Will I live forever?
Marky, I hope you live just as long as you're intended to live. God bless you. That's wonderful. You're doubly protected, and I'm so pleased about that. Now help me. Please go out and get your friends vaccinated. I'll bet you've got some friends who haven't yet rolled up their sleeve.
Very good point. Marky, thank you so much for sending that in. All right, doctor, another myth. Let's take this one. Some people are concerned about the ingredients in the vaccine. So we don't know what's in these vaccines. Why should we believe they are safe? Doctor?
Well, of course, you know, the average person doesn't know what's in vaccines. Any vaccines, the vaccines we give our babies, the vaccines we give our adolescents, the vaccines we take as adults. We have to have a certain degree of trust. The trust is, first of all, in the Food and Drug Administration. They are extraordinarily rigorous in determining of what's in vaccines. You know, some of this is related to a concern about bad effects of the vaccine. Let me make something clear, because I get this question all the time. We don't know about the long-term effects of these vaccines. That always makes we in infectious diseases scratch our heads, because with any other vaccine that we use here and around the world, in babies and in adults, there are no long-term effects. of those vaccines. Nothing that shows up 2 years, 5 years, 10 years later. The adverse effects that occur within 2 or 3 months. Those are the ones we know, and now we've given this vaccine. It must be approaching 160 million people in the United States. We know about the side effects associated with these vaccines. That blood clotting disorder was one of the ones that we uncovered. We found it even though it was a needle in a haystack. These vaccines are very, very safe.
And I'm glad you brought that up about long-term because, again, I'm going to just bring it home to a personal experience. I had both my girls vaccinated this week, vaccine number 1, and they were extremely adamant, not happy. All their friends telling them long-term effects, infertility. Doctor, can you clarify that myth, please? Because my daughters are listening right now.
Yeah. So let me be serious and not at all facetious about this. There are no effects on female, or for that matter, male, fertility associated with these vaccines. The material in the vaccine doesn't go anywhere near our genetic material, our DNA in our bodies. And the American College of Obstetricians and Gynecologists, those doctors who will care for you, whether you during your fertile periods and when you have your babies, they say these vaccines indeed may be given to women who wish to become pregnant, who are pregnant, and or are breastfeeding. These are very safe vaccines for the moms, for the babies, and they will not affect your fertility. You can be absolutely sure of that.
Doctor, thank you so much for clarifying that one. I got a great question from Donna right now on Facebook. Here's her question. At my work, there's 11 people that were fully vaccinated, but yet they got the coronavirus. What do you say about that, doctor?
Well, that sounds like a little cluster, Donna. I'm not sure about that, but we know that there are going to be some breakthrough infections. We did say the vaccines were 95% effective, didn't we? I didn't say 100%, which means that occasionally this virus will sneak through and make someone ill, but those people are going to be less affected. Here's a cluster I know about. In the New York Yankees organization, there are 7, I think that's the right number, people who have been fully vaccinated and have been infected. Now, mind you, only one person has symptoms. Those symptoms lasted 2 or 3 days, not nearly severe enough to go to the hospital. All the other people, even though they tested positive, have no symptoms whatsoever. That's the vaccine working. The vaccines were designed to make our illness so mild that we didn't have to go into the hospital. On occasion, someone will get an infection even though they're vaccinated. Pretty unusual.
Indeed. Doctor, I want to get to one more myth, and this is one that I hear a lot of as well. And let's take that if we can. Some people who have had COVID-19 infections said it wasn't so bad, and many never got infected. So if the survival rate is so high, why should people get vaccinated, especially young, strong individuals? We kind of talked about that a little bit, doctor, but I just want to debunk that myth.
So the question really has to do about younger people, younger adults, and now, of course, we're reducing the age down to what we call children. It's down to 12 years of age, and studies are underway about vaccinating grade schoolers and even preschoolers. So why should we vaccinate these young people? We know that they are less apt to have serious disease than are adults, but some of them do get serious disease. The CDC has recorded about 1.5 million cases of COVID in children, about 13,000 hospitalizations, and something on the order of 300 deaths. So on occasion, this virus can find a younger person and still make them very, very sick. So we want to protect them. And of course, by protecting them, they also contribute to community immunity. They help make the entire population safer, especially those schools. And they'll be going back to schools, those 12 and olders, vaccinated this fall. That should make the parents happy and all the teachers and other adults in the school happy.
Thank goodness. Speaking of going back to school, what are your thoughts on traveling over the summer, doctor?
Travel with care. Travel when you're vaccinated. That's the best time. I wouldn't worry so much about being on an airplane. They handle the air and filter it very well. But buses, trains, you can get very close together. And remember, in airports, keep your mask on, keep socially distant. And then where is it you're going? Are you going to visit some relatives? Can you make sure they're vaccinated before you get there?
And doctor, I have about 10 seconds. Any final thoughts for our viewers?
The light at the end of the tunnel is getting brighter and brighter. We're getting ahead of this COVID virus, but we still have to vaccinate many other people. And I would urge everyone watching who isn't vaccinated to please get vaccinated. And those of you who are vaccinated, find your unvaccinated friends and make them comfortable. Reassure them that vaccination is good for them and for the entire community.
Doctor, it's been a pleasure. Thank you so much. We hope to see you soon again on Dr. Q&A.
My pleasure, Olga. Always good to be with you.
You take care and be safe.
You too.
And thank you to all our viewers for joining us today on such an important topic. We'll see you next time right here on Dr. Q&A. I'm Olga Villaverde, and you take care.
The Health Channel wants you to have all the answers you need to be in control of your health.
Infection and the virus keeps coming back.
That's why, in addition to Dr. Q&A,
if treated appropriately, the patient should...
you can always chat with one of our health advisors through our free service, Ask Hannah. Just go to allhealthtv.com or download the Health Channel app and get the answers you need.
No question should ever be left unanswered. Remember, if you don't know where to start, ask Hannah.